This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
The World Health Organization released a study that 448 million new cases of curable sexually transmitted infections occur yearly. Among these are syphilis, gonorrhea, chlamydia, and the human papillomavirus or HPV, with 250,000 deaths each year caused by the human papillomavirus or HPV. It is the second deadliest to HIV or human immunodeficiency virus among sexually transmitted infections. With the alarming statistics on sexually transmitted infections, how do we keep ourselves from all these?
Bata pa ako. Contraceptives.
To really choose the partner that you engage in and to really practice safe sex using condoms.
Have weekly medical checkups.
Practice mo na lang abstinence kung kaya mo.
Tonight, we will talk about HPV and other common sexually transmitted infections that affect women. How can we actually prevent getting infected? What is the available cure for these? Can these infections affect a woman's ability to bear children? Join us as we answer all these questions on MedTalk.
We're still celebrating Women's Month here on MedTalk. Last week, we discussed cancers that affect women. Now we will discuss infections that can affect a woman's reproductive health. Joining us is Dr. Patricia Ko, OB-GYN infectious disease specialist from the Makati Medical Center, St. Luke's Medical Center, and the East Avenue Medical Center. Also with us is Dr. Judith Perez Peralta, also an OB-GYN infectious disease specialist from the St. Luke's Medical Center and the Quirino Memorial Medical Center. You can participate in the discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Hi, Angel.
Hello. During the VTR, it was mentioned that there are 448 million people all over the world who have been infected by an STD. How and why is this number abound?
Okay, maybe it's also because of the increased population worldwide. That's why there are more and more people with STD. Also because people are more aware, there are more diagnostic tests available, people seek treatment, therefore more cases are also being diagnosed. Another possible reason is probably earlier age of first sexual intercourse. There are also more people having more partners, therefore there's an increased chance of spreading the bacteria or the virus around.
Oh, wow. Okay, Dr. Peralta?
Yeah, well, basically it's the same thing, except for I'd like to add that the youth, okay, a lot of the sexually transmitted diseases are now found in the 20 to maybe as 20 to 30-year-old age brackets, the reproductive age group, and these are the probably the type of the population who are not so aware at this point, okay, of the dangers of STD.
Why, in spite of all the information and in spite of all the awareness, why aren't people as aware as they should be?
For example, in the Philippine setting, I don't think there's much information dissemination. We don't really talk about it. We only talk about it here in my clinic when I discuss with my patients or when I give lectures. But I'm really happy, for example, that for the first time we were invited to talk about a topic that's close to our hearts, sexually transmitted infection, which is our specialty. So there's really not much discussion. There's a lot of misinformation, and a lot of people are scared of seeking advice because they're afraid that people will talk about them, that somebody will see them consulting a doctor and saying, maybe she has an STD or an HIV. And that person is also scared that when she gets the result, somebody else will see the result. That person cannot talk about it with his or her parent or friend because of the stigma. So I don't think that there's still a lot of discussion going on. Therefore, it will be nice to keep the discussion open and inform all our audience and all the youth about the symptoms and how to prevent sexually transmitted infections.
And that is our mission here in the
Yes.
show,
Right.
to help everyone stay informed, to educate and to help everyone. That
Yes.
they shouldn't, like what you said, to be embarrassed. It's not
Yes.
something to, you should be embarrassed if you don't take good care of
Yes.
yourself, if you
Yes.
don't address this problem. And we will talk about the signs and symptoms. Let's first talk about the human papillomavirus or HPV. How does one get it? What are the signs and symptoms? Maybe we can start with Dr. Peralta.
HPV, that's a virus, right? It's a DNA virus that can be spread through genital skin-to-skin contact. And so it can develop into lesions. Okay, you can tell. There's a wart. These are like tiny bumps that occur in the skin, and they can be just single bumps, or they can form groups. And sometimes in really bad cases, they'll form cauliflower-like masses. But by that time, it's actually quite bad already. They should have consulted earlier.
Is there any color to watch out for, any discharge to watch out for when we're talking about HPV?
A lot of times they'll have a concomitant fungal infection. They'll notice there's a whitish discharge, whitish curdy-like discharge because of the, well, it just makes the vaginal mucosa is moist. So both the fungi, the yeast, and the HPV will proliferate and be more symptomatic.
So doctors, we will talk more about HPV and all the other sexually transmitted infections, but now we will talk to, or we will answer our Twitter question from Nancy Mangkit. She asks, doctors, can I get an STD from a public toilet? Tarko?
So it's very rare to get a sexually transmitted infection from a public toilet, although it's also a very common urban myth.
Yes.
Why? Because once the bacteria or the virus leaves the body, usually it already dies. And it's unlikely that when you sit on the public toilet, that certain bacteria will also enter your genital
I think
tract.
that's the fear, no?
Yes.
Women, when they sit down, they think that whatever is left on the toilet seat, assuming that they sat on the toilet seat because others stand up or
Yes.
squat,
A lot
it will
of people.
go up to their genital area. So that's not true.
Yes, and a lot of people don't usually sit on a public toilet because of that fear. So the risk of getting a sexually transmitted infection, although theoretically possible, is really very low. So most of the time, it's really through skin-to-skin genital contact or through sexual contact.
All right.
Yeah, so it can happen sometimes for HPV. Fomites, it can live for a short time outside the body, or hepatitis B, but it's not very common.
Okay, so at least we busted that myth
Yeah.
already. Or we can line the toilet bowl with tissue.
The best thing
Yes,
is always to use an antiseptic. That you can buy these sprays, these antiseptic sprays that you can spray in the toilet bowl and wipe it with some kind of antiseptic wipe. Also, hand washing is always a good
hand washing.
way of prevention.
And we're talking about prevention and wiping. Also, when you clean yourself after you urinate, I think it's the more important. It's also one of the
Right.
important
Yes.
things to remember.
Yes.
So,
Hygiene.
Hygiene talaga,
Yes.
personal hygiene. We have another Twitter question from Liza Lynn Valmonte. Can any of these infections affect a woman's ability to bear children?
Yeah, definitely. Because if you leave these infections untreated for a long time, they can lead to complications. For example, chlamydia, gonorrhea, these are notorious for later on forming abscesses or pus, collections of pus in the reproductive organs in the upper tract, no? So fallopian tubes especially, it can form masses, no? Filled with pus. And when these rupture, it can cause adhesions all over the pelvis, meaning there'll be blockages in the fallopian tubes that can obstruct the transport of the egg through the fallopian tubes into the uterus. Therefore, that egg and that sperm will never meet because of that obstruction. That's one of the most common causes of infertility.
We also have here, how do you call this?
The model.
Model. For maybe we can talk about that a little later on. But we can go back to, we've already mentioned HPV, the signs and symptoms. You've mentioned, Dr. Peralta, gonorrhea and chlamydia. Let's talk about gonorrhea first. The signs and symptoms, and where exactly in this area of the woman's body can it be found?
Okay, so usually gonorrhea is a dramatic infection. It means that when you get infected, around 1 week after the acquisition of the infection, you will really feel symptoms. So you will feel irritation in this is the vagina, irritation in the vaginal area. There will be a pus-like discharge coming from the vagina, also sometimes coming from the urethra, which is the opening of the urinary tract. And then inside, the cervix, which is the door leading to the uterus, is also very red and full of infection. So usually with gonorrhea infection, there's really a yellowish, foul-smelling discharge. But sometimes some women with gonorrhea don't feel anything. It's asymptomatic. So it can depend on the situation. Some women can really feel the symptoms, others have very, very mild symptoms.
Why is it called the clap?
The clap. Why is it
The clap.
It's called the clap. Maybe because it's found in this area that's like a flap in our bodies.
Maybe, or maybe it's because it's a very severe infection. There's really a symptom, so they feel that maybe there's a clap inside.
But yeah, you know, I was trying to imagine like an infection, and it is very uncomfortable. But again, to others, symptomatic, no symptoms at all. So when we come back, we'll talk more about this. We'll talk more about the symptoms and the signs and treatment and when to seek medical help. All these and more when MedTalk returns.
Did you know that the highest rate of sexually transmitted infections are found in urban men and women in their sexually most active years? That is between the ages of 15 and 35. On the average, women become infected at a younger age than men.
We're back here on MedTalk, still talking about the signs and symptoms of sexually transmitted infections. Before the break, we were talking about gonorrhea, and you mentioned a sign and a symptom, which is a burning sensation and itching. Other people might mistake it as UTI. So what is the difference between gonorrhea and UTI when it comes to these symptoms?
Okay, so that's very interesting because as you can see in the model, this is the urinary tract, okay, and it's very, very near the vagina. There's only less than 1 centimeter gap between the vaginal opening and the urinary tract opening. So it's very hard to differentiate sometimes if she really has just a UTI or a UTI with a vaginal infection such as gonorrhea or just a vaginal infection. Also, for example, an infection like gonorrhea will also have urinary symptoms like burning sensation when you urinate, bloody urine. So when in doubt, it's still better not just to have a urinalysis and then be medicated with the usual antibiotic against UTI, but also seek the help of an OBGYN because there might be a possibility that there's also concomitant vaginal infection.
Okay, still on vaginal infections. Now we move on to chlamydia. Please describe to us what is chlamydia, the signs and symptoms. Chlamydia.
Chlamydia is caused by an organism that's actually a bacteria. And it can invade also the cervix, okay, here. Here. So again, it goes through the vagina through sexual contact here, and it tends to live in the cervix, which is the opening to the uterus. Okay, and that's where it lives and hides, and it causes, most of the time it's asymptomatic, meaning there's no symptoms. Okay, again, but then in some cases there'll be some kind of discharge, sometimes whitish, sometimes clear, and no foul smell, no itchiness, nothing. So it's actually detected along with other infections maybe, or just one symptom that I noticed with some of my patients is discomfort. They just have this
What type of
hypogastric, or here the lower abdomen, some weird discomfort that they say is deep down. It's not just in the muscle or on the surface, it's inside.
Yeah.
And so that's one thing I noticed that they feel. And then I investigate. I have them tested for chlamydia.
Okay. So we mentioned tests.
Right.
You have them mentioned,
Yeah,
you have them tested for chlamydia. Is there a test for all? Or is there an individual test for
Individual
all of these
tests.
STDs?
Yeah, there are a few. There are 1 or 2 reliable tests per type of infection. But the general rule that we specialists follow is that once a patient is positive for one STI, actually it's nicer to say STI,
yes,
than STD, STI, or sexually transmitted infection. The rule is to test them for the others, because most likely they might be positive for the others.
And how often should one get a test?
Oh, depends.
It depends on the situation.
Yeah,
For
situation.
example,
There's
if
no
she
rule.
had a recent sexual partner, she has multiple sexual partners,
Right.
or
Or
her sexual partner had
Tested
another
positive.
partner,
Or
or the partner tested
tested
positive,
positive.
or
Yeah,
you're
another
just
thing
not
is-
sure, you just want to be tested, you have some sensation of probably abnormal discharge or lower abdominal pain, always get tested and
The most
don't
important,
be afraid.
the partner. If the partner gets tested and is positive, then the partner should also get tested,
Yes.
and the previous partners. So they have to backtrack.
Yeah.
And yeah,
I think that sometimes that's where the fear comes in, that they don't want to backtrack anymore, or they don't want to
Yes.
have to go through that anymore.
Yes, and a lot of women, once they are diagnosed to have a sexually transmitted infection, they get depressed,
Right.
they feel so undervalued, and they cannot tell their partner because they're afraid that their partner will accuse them of being promiscuous or being dirty. They can't tell anyone. So, of course, the infection keeps on spreading. It's like a gift that keeps on giving.
And it
So
keeps
it keeps
living
spreading.
in there.
Yeah.
right.
So the best thing to do really is, if you can't tell your partner, maybe you can go to your OBGYN and they can help you out, and they can
Yes.
advise you on getting tested,
Yeah.
and also how to help you emotionally, because it's not just physically that you're affected, but your emotions as well.
Yeah, very emotionally loaded.
That's it. And speaking of loaded, we have another question from Twitter. Nikki Manabat. I was just diagnosed with HPV.
Okay.
I'm wondering about the HPV vaccine. If someone has HPV already, will the vaccine prevent future outbreaks? Okay. Dr. Ko?
So, HPV really is has multiple types of viruses. So, HPV, human papilloma virus, has so many subtypes, hundreds and hundreds of subtypes. So, if for example she has been infected with HPV type 16, then she can still benefit from the immunization by being immunized against the other HPV subtypes that can cause genital warts or cancer of the cervix.
So you also have to choose which specific vaccine you would.
Yeah, there are two choices.
Yes, there are two
In the market.
choices. Yeah. There's one that covers against the HPV type 16 and 18 only. Those are the two most common HPV types that cause cancer of the cervix. And then there's another vaccine that also covers not only against the type 16 and 18, but also against type 6 and 11, which are the two most common HPVs that cause genital warts.
So if one has HPV and one has been vaccinated, does that prevent or does that prevent one from getting cancer of the cervix? Is one assured of being spared from the cancer of the
There's
cervix?
a 97 to about 97% chance of success, right?
I know it's 80%.
80?
Yeah.
80 to 97%
Yeah,
maximum
yeah.
against 70% of the HPV
Ah, yeah.
that causes cervical cancer.
Yes, yes.
So it has a high effectivity rate, but of course there's always that tiny chance, so you still have to be careful. It doesn't mean that once you're vaccinated you can already be as careless as you want to be, right? So it's just something that can help you, but not the total answer.
Yes, yes.
Since we talk about numbers, how about the age? The age when one can get this injection? What is the recommended age?
The youngest is around 9 years of age.
Why is
Yes,
that? Why
9 years of age onwards. Because at childhood, the children really have a good immune system. So
Right.
if you vaccinate them in childhood, usually they will really produce a lot of the antibodies.
Right.
Number two, we have to vaccinate the children before the age of first sexual contact. Because once they have only one sexual contact, they're already at risk of getting an HPV infection. So the effectivity of the vaccine will also be reduced. So of course, it's not the doctors did not mean it to promote early sexual contact.
Yes.
It's just the reality that at least that child is already immune. So in case that there has been sexual
Exposure.
intercourse, exposure, not just sexual intercourse, but skin-to-skin genital contact, that child is already immune.
Yes, it takes a while for them to build up that immunity and to produce those antibodies. But like she said, the younger they're vaccinated, the more antibodies they form compared to the amount of antibodies that they would form if they were vaccinated at an older age.
Okay. Thank you, doctors. Facebook question from Leslie de Guzman. Can I acquire any of the infections from kissing?
Yeah, actually,
Yeah.
herpes, number one.
Yes.
Herpes virus,
Okay.
type 1 and 2,
From kissing.
from kissing.
So what are the signs and symptoms? What do we see on our lips when we do have this infection?
Herpes looks like a blister. It starts off looking like a blister. It's like a
Cold sore.
A cold sore. Okay, it's first starts off being filled like with fluid, and then it bursts, and then it turns into some kind of ulcer. But the HSV type 1 is not always sexually transmitted.
Yes.
However, you can get that infection through kissing. And then, of course, there's the oral genital sex,
Yes.
right? So that can transmit anything that's from the genital area to the mouth, and then from the mouth of that infected person, it can be transmitted to the mouth of the partner.
Yeah.
Wow.
So like
yeah.
gonorrhea, it can be transmitted through oral sex, for example.
Yes. So it's not confined.
Yeah.
So we talk about the signs, symptoms, treatments. How about the cure? Is it controlled? You can control it, or is it curable? These sexually transmitted infections.
So most sexually transmitted infections, fortunately, are curable.
Yeah.
It's best to really seek medical attention as soon as you feel that you have something. in order to prevent any serious problems like Dr. Peralta mentioned, the abscesses or infertility or ectopic pregnancy. But fortunately, most of them can really be cured with medicines, and there can be no permanent sequelae. However, there's some infections that cannot be cured, like herpes and HIV.
Okay, but they can be controlled.
Yes, they can be controlled.
There's medicine for
With,
that. There's treatment for that.
antibiotics,
Yes.
So we can one can take the antibiotics and frequent visits to the doctor to see where the infection is at, or where
Yes,
the
so
disease is at.
they can still lead normal, productive lives, just like anybody else. They can still have children. So it doesn't mean that it's a death sentence to have a sexually transmitted infection.
Well, that's very good to know.
Right.
A Facebook question from Mary Ann Mariano. I can't get rid of the lice on my head. Should I worry that they might affect my pubic region as well? The lice in the head going down to the pubic region.
It's usually a different type of organism, but they're both treated the same way. There are shampoos available that will kill this louse, and so they can be cured of that quickly.
So they can travel from the head.
Yeah, the best thing to do is they have a head. If they have head lice, they should have that treated.
Okay.
It's might be possible, right? But they might not thrive in the genital area as much as the actual crab louse. The crab louse is the one that's known to be a resident, a frequent resident of the genital area. And there's also shampoos, medicated shampoos to get rid of that.
So if you can't get rid of the lice in your head, the fear of having crab louse is not so, it's not there, it's not imminent.
It's
Yeah.
not really
I've
the same
never
thing.
seen someone with head lice and
That has
then
traveled.
being transmitted to the pubic hair. Have you seen a patient with that before?
Not really.
Not really, yeah.
But I don't want to say
Yeah, okay.
never.
But you know what we want to say? We want to hear tips. Before we went on air, I understand that there was a tip with A, B, and C, with these letters A, B, and C.
Okay.
We have to wrap up in a bit, but I'd like to hear the ABCs of prevention of sexually transmitted infections. Let's start with you, Dr.
ABC,
Arco.
the alphabet. A is the best way to avoid the sexually transmitted infection is to practice abstinence. So don't have sex ever.
Okay.
Are you sure?
Ever. Okay.
I don't think anybody's going to follow that rule.
So how many can follow that?
I think we should qualify that. Don't have sex if you don't know your partner.
Which
So you
leads
have
us to B.
Yeah. So B is be faithful. So practice mutual monogamy. Both are mutually monogamous to prevent any infections from entering the relationship. And then C is use a condom consistently.
So safe sex is
Yeah.
and the safest sex ever is not to have it.
Yeah.
Yes.
Or know your partner.
Or know
I
your
always say,
partner
I
and
always
be
give them a
honest
way
with
out.
your partner and know your body.
Yeah,
I
and if
always
you-
say that you have to know your body, see the changes that are happening, and address it right away. So that's what we've done here on the show. There's not a lot of time. I wish we had more time to talk
Yes.
about this. Maybe we can invite both of you again. Thank you very much, Dr.
Thank you so
Arco.
much.
Thank you very much,
Thank
Dr.
you,
Peralta.
Angel.
I'd like again to thank our doctors for enlightening us on how to take good care of our bodies and preventing STIs. Thank you again to Dr. Patricia Ko and Dr. Judith Perez Peralta. See you again next Tuesday on MedTalk as we discuss infertility. 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Good night.